Hello everyone. So today we shall look at this rare condition in dermatology. We call it Firma Forme dermatosis. So in this case, it's not a dermatitis but a dermatosis, because usually you need to tell a difference between these different things when you say a dermatitis and then a dermatosis. So here there's no inflammation of skin, but just a disorder of the skin without actually inflammation. So the terraforma for me is one of the rarest, but in case you meet it and you don't know it, actually it can be one of the most ashaming conditions. It's like failing to diagnose syphilis when you are coming from our resource limited setting, and then you don't know how to make a diagnosis of syphilis. It's really ashaming. So as we can see in this picture, we see someone having these dirty looking like flakes on the legs that can be removed by alcohol, but cannot be removed by the normal soap and a sponge. So it's also called dermatitis. Quite rare, but when you see it, usually it is very easy to diagnose. So today I'll take you through what it simply means, so that in case you find a patient with it, you are very, very comfortable with making the diagnosis. So, what do we know by Terra Forma disease? So, the TFFD disease, it is a benign acquired pigmentation disorder. It was first described by Duncan and the colleagues plus Knox. So in the 1987, Duncan was able to describe this condition in a couple of patients, about five patients, whereby he noticed that they were having these very thick plaques on the skin, especially on the lower limbs and the neck. But when you try to wash them with soap, they don't go away. But when you try to use an alcohol pad, they could actually get better and resolve. So that's why it was also called the dampness dermatosis, and it's usually characterized by these brown gray black patches with a data-like appearance. It can affect everyone in all ages, but commonly seen in children and young adults. So when you see such a manifestation, you have to have the idea of what is actually going on. So when you go to its presentation, the epidemiology, this condition usually has a prevalence which is not well documented because it has not been yet described by very many people in the different settings, but it is believed to be underestimated. Maybe people see it and diagnose it as something else, maybe atopic dermatitis, maybe ichthyosis because it looks like those hyperkeratotic disorders. But a retrospective study of about 1 year found about a prevalence of 2.19 in the different in an outpatient setting of adolescents and children. So it is fairly cases. So if you see about 2 cases per 100 people, it's fairly common, and there's no gender predilection, and there's no genetic transmission. So most commonly affects children and young adults. So in the clinical presentation, so someone will have those patches that will be gray, brown, black discoloration like, and sometimes they can have a velvety or hyperkeratotic appearance, the way we see melasma, and and sometimes these rashes are commonly found on the neck, face, trunk, and also around the ankle or around the navel or where you have the umbilical stump. So there are usually no symptoms in these cases, so patients will just have this slightly mild itching and burning, but other than that, there will be no major symptoms. So the diagnosis is often clinical and can be confirmed by an alcohol swab, something that you have in your office. So you just need 70% isopropyl alcohol, and then when you apply it and rub the area, it clears completely. So that's how we confirm the diagnosis. As you can see in this picture here, so this is how it will appear like this velvety brown, blackish flecks on the neck. So when you get this alcohol swab and try to apply here, the lesions try to disappear. So the exact cause of pathogenesis of this condition is not clear, and possibly it is related to altered keratinocyte maturation, and sometimes we have associated it with poor hygiene, maybe retention of sebum, and poor post-surgical care because of it being also reported in post-surgical patients. So there's also an hypothesis that links it to sun exposure being one of the risk factors, physical disability, patients who cannot actually clean themselves very well. So it has also been associated with that. However, genetic predisposition is not yet confirmed, but sometimes there are cases that were reported in a family, so they thought maybe a genetic link, but not yet confirmed. So it is thought to be a retention of hyperkeratosis of keratinocytes, and that is the disorder that we are looking at today. But all this is not yet confirmed, so it is just something that is that occurs, but the exact cause is not yet known. So when you do a sample and then you see how it looks like, sometimes you pick epidermal atrophy. You can see the basket with hyperkeratosis, the basket with pattern in the normal skin. In this case, it will be accentuated, it will be a lot. And then some patients you see increased melanin deposition in the basal layer. And then sometimes you see a sparse lichenoid inflammatory infiltrate in the upper dermis. So it looks like more of a lichenoid dermatosis sometimes, but they're just a slight infiltrate, sometimes hypermelanosis, but there's no leakage or melanin incontinence into the dermis. Then you have hyperkeratosis of the basket with pattern. Then sometimes you see keratin walls and lamella hyperkeratosis as some of the features in this condition. So when you are looking at this condition, there's a lot of differential diagnosis or things that can look the same. Is dermatosis neglecta, the one we see in poor hygiene. Someone gets hyperkeratosis in the skin because they're not bathing or they have been neglected. And then you have acanthosis nigricans, which usually gives velvety plaques, which can be commonly seen in the body soils, including the axilla, around the neck, around the face, also been reported to be on the hands and also in the palms, which usually we call the triple palms. Then sometimes it can look like the confluent and reticulate papillomatosis, the one we see it being caused secondary to Malassezia species. But sometimes it can also look like seborrheic keratosis, ichthyosis, hyperpigmented pityriasis vascular. So when you see pityriasis vascular, make sure it is actually pityriasis vascular, because sometimes it can be this Terra Firma Forme Dermatosis. So when you're making the diagnosis, the clinical diagnosis is a little bit easier to make because it's based on the appearance and then the disappearance of the lesions when you use the alcohol swab. And in this case, when you do a dermoscopy, you see brown polygonal scales, which usually have a mosaic pattern. And if you do biopsy, then you see the features that we mentioned earlier. The basket with hyperkeratosis, the slight lichenoid infiltrate, and sometimes you can see hyperkeratosis as well. So the first line treatment is actually diagnostic test. In this case, you just get your alcohol swab with 70% isopropyl alcohol, apply on the lesions, and that will clear. And that's what you give actually the patient. So the patient comes to hospital and ends up going back with alcohol. So in that case, that is what makes it more interesting. Some other options you can try out. You can give keratolytic drugs like urea-based creams. In our setting, we have things like benign moisturizer. We have things like UDAM, Epimax, all those urea-based creams. Then you can apply topical retinoids and salicylic acid as well. And then CO2 surfacing laser can also be applied in this case. So recurrence is a little bit rare. Sometimes we treat once and doesn't come back. Sometimes cases can even resolve without any complication or even without treatment. So in the prognosis, the condition is benign and easily treatable. Lesions usually resolve with alcohol swabbing, and No long-term complications with associations have been reported. This is a low recurrence rate of about 5.6% of the cases having issues of it recurring again. So every time you see this condition, just know that you just need alcohol and the patient will be fine. So thank you very much. This was a short one, and we encourage you to subscribe so that you learn more of this dermatological condition. Have a good one. God bless you.